Hello, dear friends and medicine passionates. Welcome to a new episode of the Medvoice podcast in a slightly different format. We kept the quality, but changed the language. Today, we are honored to have as a guest Dr. Hani Al-Qadhi in our studio. Welcome, and we are very happy to have you here.
Thank you so much. It's my honor to be here with you.
Dr. Hani Al-Qadhi is a senior consultant and a general and trauma surgery at Sultan Qaboos University Hospital of Muscat, Oman, where he has also graduated medicine as top student. He did his surgical training in Canada before returning back to Oman, where he built a successful career. Thank you, Dr. Hani, for being here, and we are open to share your valuable lessons with us.
Thank you so much. I hope it's going to be an entertaining and useful interview for everybody.
To start off the conversation, we are curious if you could tell us some things about the medical system in Oman, from education to infrastructure. For example, how difficult it is to join the medical school in Oman.
Okay, we have two medical schools in Oman. One is government, which is the Sultan Qaboos University, and the other one is private, and it's called the National University for Science and Technology. To get into the government medical school, which is the Sultan Qaboos University medical school, you need to score very high in the diploma of the high school diploma. And year after year, the grades are getting higher and higher. So I heard that even 98% in high school can put you in jeopardy of not joining the medical school.
Wow.
Yeah, it's that high. It's a 6-year course, and at the end, when they graduate from medical school, they do 1 year of internship, which is basically divided into 3 periods: 4 months, 4 months, 4 months. 2 of these periods are in general surgery and in medicine, and then the third one they can choose between pediatrics and obstetrics and gynecology. Then after they finish their internship, they join residency program of their choice.
So to get into med school, you just need the grade from high school, no exam.
No exams.
I see some similarities, but I think in Romania there are a lot of misconceptions about the Middle East, and we are favoring Western system countries in general.
Yes.
Even myself, before going to Oman in my medical exchange last summer, where I also met you, I didn't expect it to be such a developed country.
Yes.
So could you make a general description of the hospitals in Oman and give us an overall view of the healthcare system?
Right. So we have, just like the medical school, we also have in the healthcare, we have private and government sectors. The government sectors or hospitals are between mainly 3 systems: the university hospital, the Ministry of Health hospitals, and the armed forces hospitals. So these are 3 main systems where people get treated according to their, if they are eligible to be treated in the armed forces hospital, so they go and be treated in the armed forces hospital. Otherwise, they are treated either in the university hospital or in the Ministry of Health hospitals. Medical care there is free for everybody. There are no insurance, but some people apply to get insurance, or they get insurance if they work in certain companies, but that's for private practice, if they want to go and be operated in the private hospitals. With regards to the private hospitals, we have a lot of big private hospitals in Oman where they have their own staff, but also staff from the government hospitals. They can go and work in the private hospitals after working hours, so in the evening. And that kind of provides more options to patients to access healthcare. The students and the residents in their training, they rotate in the government hospitals, not in the private hospitals. With regards to training, after the internship, we have a training body called the Oman Medical Specialty Board, where there is about 18 programs, different programs, for Omanis to apply. And if they get accepted, they start their training program in these programs. Like, for example, general surgery is a program of 5 years. And then when they graduate, they get the board, the Omani board, after 5 years. Medicine, I think it's 4 years. Pediatrics, 4 years. Obstetrics, gynecology is 5 years, etc.
Yes, like the residency.
Residency.
Yes.
And it's based on the North American model, the training program. And then when they finish, they go and do fellowships, which is subspecialties abroad.
Mm-hmm.
Most programs, they send their residents abroad to do subspecialties or fellowships. If there are no programs, like plastic surgery, we don't have a program yet. Urology, we don't have a program yet. Neurosurgery, we don't have a program yet. So these, they get sent abroad to do the residency from the beginning.
Is there a reason for which you don't have these programs?
Yeah, so we don't have enough training staff to enough the number, the mass of trainers are not sufficient in these 3 specialties. But I think more and more now Omanis are getting trained in these specialties. So I think soon enough we will have these programs running. There's now talks about urology starting their own program. I think plastic surgery will take a little bit of time, but I think urology is the best has the best chance to start, and then neurosurgery, and I think plastics would follow.
So after they finish med school and 1 year of internship, they have an interview, or how do the students choose their specialty?
So what they do is first of all they have to have a good CV, and then they apply for whatever program they want. And then they get 2 programs to choose. And then they get interviewed in each program. And then if they're selected, they go into that program. If they're selected in both programs, so then they ask them, you've been accepted in both programs, which one would you choose?
And to shift the course of the conversation a little bit on your medical journey,
yes.
After you finish med school, what was your motivation to follow surgery and further trauma surgery?
A good question. So when I was in medical school, I loved all specialties, to be honest. I loved gynae, I loved medicine, I loved surgery, but surgery was more passionate to me. Because when I worked in medicine, I thought that, and no offense to my colleagues in internal medicine, but the patient just don't get cured. If you have hypertension, you will always be in hypertension. If you have diabetes, you will always be a diabetic. And I didn't see that there is cure. It's just modifying the disease or controlling the disease rather than curing the disease. So in surgery, the patient will be sick. They will come, they will get the surgery, and they're cured. No more. I think that's the main attraction that attracted me to surgery. And then there is that misconception that in surgery you don't know much, but you do a lot, like you cut without thinking. That is very old
mentality
and profiling. Now in surgical residency, we have a lot of medicine involved. So basically we are physicians with skills. And that's what attracted me to join surgery.
It's interesting because I hear from a lot of my colleagues now, we are in 5th year, and a lot of them want to join the surgical field because of the immediate impact they have on the patient.
Yes.
And I think it's really important to know ourselves and to know what we want in order to get it and do it with a lot of passion.
Yes.
But in Romania, we have traumatology with orthopedics together as a specialty. Can you explain a little bit how traumatology works and what's the difference between it and orthopedics or even emergency medicine.
Right. So yeah, in Europe in general, most European countries, trauma is run by orthopedics. Even when I introduce myself as a trauma surgeon, they immediately think I'm an orthopod. But no, in the North American system or model where I trained, trauma is a subspecialty of general surgery. I mean, there's also trauma orthopedics and there's also trauma emergency medicine, but they're not trauma surgery. They're trauma orthopedics and trauma emergency medicine. So any patient that comes in the trauma bay, we take control of the patient. We are the first people to see the patient. If there are fractures, then we call the orthopedics trauma people to come and fix the fractures. The emergency physicians, they can only manage the initial management in the emergency room, but they cannot take the patient to surgery. So if a patient comes, we have certain criteria as to when to call us, when to call the trauma team. For example, gunshot, you have to immediately call the trauma team. If you imagine, a person who has a gunshot to the chest, why would they call orthopedics, for a gunshot to the heart, for example, or to the chest, or to the abdomen, or to the liver, or a stab wound in the abdomen? Why would you call orthopedics for that? So it doesn't make sense to me. But it makes more sense that the people who are going to deal with the life-threatening conditions should be the people who are treating the trauma first. While orthopedic fractures, they're not immediately life-threatening. Yes, you can lose blood from certain fractures of big bones, but we can deal with the initial management of these fractures and then call orthopedics to come and fix them. But we deal with the immediate, we are the ones who have the immediate contact with the trauma patients when they come.
So, as I mentioned, you specialized in Canada.
Yes.
So, what were the main aspects you considered when you were given this opportunity to live abroad and study?
It was it was a very nice experience, to be honest. So the first, when I finished my medical school and when I finished my internship, there was no residency program in Oman. There was no Omani board, Oman Medical Specialty Board. So if you want to specialize, you should go abroad. Back then, most people would go to the UK, and some of them would go to other countries, like Egypt, for example, would do their training. But Canada was not well discovered. And there's one visionary doctor who was a leader of training in Oman. He made the connection with Canada and came and told us about the opportunities that are there in Canada. And we started applying to Canada, and it was very difficult to get application, accepted in Canada. A lot of competitions. So you will have a competition with, for example, 22 applicants for 2 seats. And these are the non-Canadian applicants. Canadian residents will have their own seats, but then they would leave, for example, in surgery, they will leave 2 seats or 3 seats for non-Canadians. Now, all the applicants from the Gulf countries like Saudi Arabia, Kuwait, Qatar, Emirates, Bahrain, Oman, they will all apply to these 3 seats. So there's a lot of competition.
Wow.
Yes. So you have to have a very good CV, and you have to perform very well in the interviews. So I got accepted in McGill University in general surgery, and as an R3, after 3 years, I switched to University of British Columbia in Vancouver, where I continued my residency and graduated from University of British Columbia in Vancouver, and did my 1 year of trauma surgery fellowship in Vancouver as well. And then I went back to Oman.
And what were some of the challenges you encountered? For example, your family life or...
Yeah. So I had a daughter. When I started in Canada, I had a daughter. She was already a year and a half old. And my wife also is a doctor. So she was also a resident in pediatrics. So we were all full-time residents, and in a foreign country, we don't have any help at home. So we had to find a nanny. We had to find an apartment and buy a car and figure out a daycare for our daughter, and these are the main difficulties that we found there. But the Canadian people are amazing people. They're very welcoming and very receptive to foreigners. So we didn't find any hostile environment in the hospitals. Actually, very friendly. So that helped. The other thing that didn't help is the weather in Montreal. So in the winter, it goes down to minus 30, minus 40.
Coming from Oman, that must be hard.
I remember once in March, I had to go back to Oman, and it was minus 30 in Montreal. And when I went to Oman, it was plus 30. So in one day, I went from minus 30 to plus 30. But and then long working hours in residency in Canada. So we start the day at around 5:30 in the morning or 6. And we come back, if we have a light day, we come back at 5 o'clock in the afternoon at home. So in the winter, it gets even more depressing because you go when the sun is down and you leave the hospital and the sun is already down. So you go when it's dark and you come out when it's dark. You never see the sun.
Yeah.
So it becomes a bit hard. But otherwise, the training environment was very, very nice and very structured training. So you know what you're going to expect in your first year residency, in your second year residency, in your third year residency, and so on and so forth. And the system is very supportive to residents. So you have rights. Nobody can abuse your rights as a resident. Of course, you have also responsibilities, but the main thing was that residents' rights were very much supported.
And what do you think were some of the secrets in getting accepted there?
Secrets in getting accepted there. One of the secrets is having a good CV. Some programs now require you to go and do an attachment with them before before the interview, so that they can see you. And when you do well in the interview, it boosts your application. Another thing is the recommendation letters or recommendation from other colleagues. Like, for example, when I went to UBC, I was the only non-Canadian resident in all the surgical specialties, not just in general surgery. Neurosurgery, gynae, you name it, urology, vascular surgery. They don't take any non-Canadian. Unlike McGill, they take a lot of non-Canadians. So, and the only reason why they accepted me in UBC is because I was recommended by a surgeon, a very famous surgeon in McGill.
Mm-hmm.
And of course the CV and everything else. But the main thing was that I transferred from McGill. So when I finished at UBC, when I graduated from there and I went back to Oman, I contacted them and I was like, why don't you take Omanis now that you have tried working with Omanis, and I hope it was a good experience. Why don't you entertain taking more Omanis? So they started, they studied the situation and they started accepting one Omani resident every year. And that Omani resident, of course, has to go through an interview, but it's mainly the recommendation from me and from Oman. Once they get that recommendation, they know that this resident is good.
Mm-hmm.
And of course, we send only the best, so that when they go there, they do very well, and so on. So recommendation is very important, and also your performance is very important. Your CV and your performance when you go there.
I was asking because in Romania we mainly base our decision on exams. For example, even for residency, we are taking the residency exam, so there is no interview or CV part. And I think it's very different in other places.
Yeah, I mean, there are so many ways to skin a cat. Sorry for the cat lovers. But uh, in my opinion, just relying on a paper exam is not the best even though that's the mechanism that we use to choose students to medical school, because we only rely on the high school diploma. We don't do interviews. But I think interviews add a lot in accepting residents in the residency program. For example, in Oman, when we accept people in the residency program, we don't only rely on the interview, but we also ask the residents who are in the program about their feedback with regards to the applicants, because they would have worked with them. So they will also give us feedback about the applicants. And to our surprise, sometimes we discover things that we never knew about that applicant, positive or negative.
And what were some of the good practices you found in Oman, in Canada, and brought back to Oman?
Good practices, yeah, a lot actually, a lot. Dedication to work, dedication to your patients, professionalism during you know your basically your encounter with the patient is very important there in Canada, and that I'm sure everywhere else, but that's what I learned from my residency in Canada. Um, for example, if you operate on a patient and God forbid the next day patient develops a complication and you were on duty the night before, the next day something happens to your patient, you come back from home to deal with the complication, that because that's your patient. And also they used to give us a lot of responsibilities, so they make you develop your decision-making skills. The consultant is always there with you, so you can make your decision, and after you make your decision, you review it with the consultant. So he kind of adjusts that. And they also teach you to lead. So the leadership skills are very, very important there. That you actually get assessed over your leadership skills, like leading the team, teaching the medical students, teaching your juniors if you are a senior resident, taking care of your patients. Are the patients happy about you or not? The nurses, they ask the nurses to give feedback about you every month. So they ask the patients, the nurses, the students. So you have to be on your toes with regards to all these elements in order to get a very good evaluation. So with time, it becomes second nature to you, that you take very good care of your patients. You explain to the patient everything. You're honest with the patient. So even if something went wrong, you have to speak to the patient and tell them that something went wrong. The correct way of also speaking to the patient and what to say and what not to say, these things are very important. And these are things that we learned and we brought it back to Oman, and we tried to instill it in our residents as well.
When I was in Oman this summer, we were in the ICU, and when the nurses were washing and cleaning the patient, for me it was really interesting that they covered like all the other parts except the part that they were cleaning. And as you also told us, it's a lot about the dignity of the patient and taking care of him or her, even though they are not conscious, because they were, of course, intubated. And I really found it interesting, and it was a real lesson for me.
Yeah, it's very important in our system to treat the patients like you treat your family, basically. And I always say, you probably heard me saying this to our residents
Many times.
Many times. Whatever you would like happen to your family member, then that's what you should be wanting for your patient. And the opposite, whatever you don't would want to happen to your family, you should not allow it to happen to your patient. So that starts from you knowing everything about the patient, the way you talk to the patients, the way you spend time explaining to the patient, and of course making sure that all the treatment and medications are correct and given in the right time. Physiotherapy has been contacted. Have you called physiotherapy? Don't just put the order, for example, and leave. Make sure that these things happen. And of course, as you said, the dignity of the patient. So the way, when you examine the patient, you should always draw the curtains close.
Mm-hmm.
Make sure you expose only the part that you're going to examine. Don't just expose the whole patient, and so on and so forth.
Yes, I think you also told us that maybe from Canada, I'm not sure, that they even fail you at the exam if you don't take care of these things.
Yeah, because you get monthly assessments in Canada and in Oman, because our system is also based on the Canadian or similar to the Canadian system. So we evaluate our residents monthly, and these evaluations. So you can pass your written exam, but if you fail those evaluations, you will not progress. You will fail. You can actually be prevented from going to the written exam if you have bad evaluations. Um, so that what is most important for us in the training is to train um, a human being, okay, and or the human factor of the resident, and then the clinical aspect, and then the leadership and academic part comes later. Yeah.
Yes, I totally agree that it's very important to train doctors, but also the human in the doctor, not just the clinical part.
That's right, because we deal with the patients in their weakest point in life. When a patient comes in pain, that's patient. And no matter how powerful that person is, when they come to the emergency room or when they come for surgery, they're at their weakest point, and that's not the time that you want to treat them in a bad way. So you have to put that in mind.
Yes, and also maybe that's the 100 patient that we see with that disease or that condition, but for him or for her, it's their only event.
Exactly.
Like that.
Yes. Yes.
Yes, so I'm sure that during your career as a trauma surgeon, you encountered many happy ending stories, but also maybe less happy
Yeah.
events. Was there a trauma case that marked you in any way or that changed something in you?
Of course, every encounter changes something in you, even if you don't notice. Uh, Mainly to the positive, but uh, sometimes you get humbled when things don't go the right way. You can try your best, but as I always teach my residents and students, trauma patients are unforgiving. They do not forgive your mistake. If you make a mistake, they die. Uh, so there is no time for you to start thinking and making differential diagnosis and consulting others, and you have to take action, and the action has to be according to a regulated system. So we work like robots basically. But yeah, there are many cases that comes to mind that either affected me positively or negatively. One of the do you want the positive or the negative first?
Both. First, as you want.
One of the positive ones, we had a patient who was shot. He had 30 bullets,
30.
plus or minus, 30, plus or minus, but not like big bullets. You know those shotguns? So small like pellets, but 30. We counted it. It was, I think, 30, 31. But all over the chest, abdomen, and the pelvis. And he was hemodynamically abnormal. He was going to die, and he had a wife and two daughters, little daughters, and they were there. And we took him to surgery, operated on him. Usually, we don't like to spend more than 1 hour in the surgery, but with him, I think we stayed for about 2.5 hours, fixing everything, and he survived. He survived, and the amount of gratitude that we got from their family and their daughter, his daughters, his wife, that just tells you that nothing can replace this. No money in the world can replace this moment when you see the gratitude in the family's eyes, and his daughters coming to hug you and stuff. It's a very, very remarkable moment in my career. Of course, I was a resident, so I'm not the main surgeon. There was a trauma surgeon who basically commanded the surgery. But I was a senior resident, so I was dealing with the family a lot, and I was, you know, I did a good part of the surgery with the consultant. So that's one of the positives. One of the negative ones, we had. Don't know about Jehovah's Witness.
Yes, yes,
Yeah, so
yes,
Jehovah's Witness. So they don't accept blood transfusion,
yes.
basically. And we had once in Canada, in Vancouver, I remember, a father who had an accident with his daughter. He was driving, and the daughter had a pelvic fracture and splenic injury. And she came and she was very hemodynamically abnormal, like she was very hypotensive and crashing. And we wanted to give her, the father was okay. We wanted to give her blood, and he refused that we give her blood. And unfortunately, she died. Of course, there in Canada, there's a system where you can call the court, and they give you a court order to overrule the situation. But by the time you call and you get the court order, it takes about 2 to 3 hours minimum. That patient did not survive that. That until today, that was traumatizing of how we could have saved this girl, but we couldn't. It's still traumatizing me because for me, I can see blood and no problem. I can see the most horrific injury, but when it comes to children, I'm very weak. Like it really touches you deeply. And not only me, the whole team was devastated. Like people were crying, not in the emergency room, but later on when we went upstairs, it really affected us. This is one of the negatives that we saw. But we learn both positives and negatives. So you learn to respect autonomy of patients. At the same time, you learn that you are the best lawyer, not just doctor. That will guarantee the rights of your patient. So you have to fight for your patient no matter what. And then hope for the best. Sometimes it works, sometimes it doesn't. So, yeah.
Life in the operating room seems pretty intense.
Oh, yeah, it is, yeah.
And in addition to this, you were also head of the surgery department for 7 years after you went back to Oman. So how is it to have so much responsibility in such a big hospital? And did you fear that this position pushed you away from the hands-on medicine?
Very good question. Actually, I was the head of surgery in the university hospital, which includes all the subspecialties of surgery. So we had cardiac surgery, general surgery, vascular surgery, urology, ENT, pediatric surgery. I didn't forget any. No, not gynecology. ENT. Did I say the ENT already? Neurosurgery, orthopedics. So they were all under the surgery department, and I was head of surgery for 7 or 8 years, 7 years, plus 1. At the same time, I was also the program director of General Surgery Residency Program in the Oman Medical Specialty Board. So I was head of surgery as well as the head of or program director of the residency program. At the same time, I was one of only 2 trauma surgeons in Oman, actually, but mainly in the hospital. So it was challenging, but I love challenges, and I think I managed to balance all 3 of them. The clinical practice, so I operate regularly. I take on calls. Actually, once I had 2 surgeons had an argument over the on-call schedule.
Oh.
Yeah, and I was the head of surgery, so they came to me and they were like, he's giving me more calls, and the other one was arguing. So I asked the secretary. I said, "Please sit down." I asked the secretary. I told him, "Can you please just bring us statistics of last year? Who are the surgeons who had the most on calls?" And it was me. And those two who were fighting had the least number of calls in the last year. So they got the message and they left. So even though I had all these responsibilities, I was still doing my on-call duties, my clinical duties, my teaching duties for medical students, and my training, supervision of training of the surgical residency training program in Oman, where we have changed a lot as well in that. Yeah, I kind of tried to balance it all, and it worked. And also, I had to also do my duties towards my family. I have a daughter and a son. And one of the things I had was I coached my son's football team.
I saw a video about it.
So I was also a football coach. Yeah, and they all worked well.
You just told me all of this story at the right time, because the next question was about the balance and how to keep a balance between all of these responsibilities, and mainly in a surgeon's life.
Yeah,
And also keep up with the family life.
that's a very good question. You see, a lot of people have a problem with multitasking. I think this is just my point of view. I think it's all about priorities, not about um, uh, too many responsibilities. So, for example, I was the head of surgery, I was a program director, I was a surgeon, and I was a father and husband.
And the football coach.
And a football coach. So when I go, like when my son or daughter have something at school, an activity, so that takes priority over everything else. So that's the main priority. Uh, so I would, of course, I have a very good colleagues with me, very good system in the department, where any one of us that has to go outside for a reason, the others will cover for him or her. So, so that helped as well. If you have a healthy working environment, it helps you to multitask. Also, if you have an understanding family, that also helps you to multitask. So they would understand that you're busy because they know that if they need you anytime, you're going to be there. So I think shifting priorities is the best thing. That means you can't have family as priority all the time, or work as priority all the time, or your teaching and education as priority all the time. You just have to be mindful and try to be flexible in shifting priorities between the different important aspects of your life in order to keep that balance. And then try to have fun as much as you can whenever you can. So instead of when you have free time, some people when they have free time, they spend it whining and complaining about what they were doing all week, or have a very busy work, and they just keep on preoccupied by that hard work. And that's where the problem is, I think. I know how to separate. Whenever I'm home, I separate from work totally. Like I don't think of even if I had a very bad day, when I go back home, it's over. Let's just take care of that. And then when I go back to work, I can worry about work again. So I think that what really helped me. And when I coached my son, my wife told me, "You're not going to be able to, to do that. It's like day in, day out. It's, every week there's a match, and it's like a national competition." I was like, "No, I can do it." So every Thursday, it's dedicated. So there's no on calls. I make sure I have no on calls. I make sure I have no duties. And if I have anything, I will ask a friend of mine to step in for me, because I have to be coaching my son that day. Yeah, my son's team. Yeah.
Yeah, I think at the beginning he was even reluctant that you are going to do it.
Yes, he was worried that I'm not going to be able to do it, but I did it, and we got the second place in the league, which is
A big achievement.
a big achievement for a group of a team that has a surgeon as a coach, and my assistant coach was a high school student. When the other 9 teams were like football academies,
Yeah.
with a coaching staff and assistant coach and fitness coach and so on and so forth. But yeah, if you just, I think if you have the right priorities and you adjust them properly, then you can multitask very easily, I think.
Yeah. And I think it's very important to love what you do.
Of course, yes. Um, that's why I always, when I give career guidance to my students, as I don't choose a career based on how comfortable you're going to be. Because this career or this specialty that you're going to take, you're going to spend every day of your life for the next 40 years practicing or doing. So don't look at whether or not I'm going to do on-call duties versus no, I'm going to go home at 2 o'clock every day. That's not the reason to choose, because you can be going to work from 8 to 2 every day and going home, but you don't like that 8 to 2 period. Every day you're going to go and do it, and you don't like it every day. So you're not going to survive.
It's half of the time.
Half of the time. And imagine like all these hours you spent in a place that you're not passionate about, you don't really are not really interested. And then you will always feel that you have given up on something that you really wanted. So that sense of disappointment also adds to the misery of your life. So it's always advisable to choose the specialty of your passion and of your what you love to do every day for the next 40 years of your life. It makes it much easier.
So after you came back from Canada to Oman, most of the department, there were mainly men.
Yes.
So you tried to make it equal and bring more women to the surgery playground. But what do you think is the stigma behind this subject, and how can we combat it?
So so when I was the head of surgery, as I said, and also I was the program director of general surgery. So it was about my main mission was to recruit the best and the brightest to surgery. I noticed that top students were going to internal medicine, not coming to surgery. So, and I took that personally. So I was like, no, we have to attract these bright minds to surgery. And I found out that the main reason that they're not coming to surgery is that there's a toxic environment in surgery. And I think one of the reasons why it was a toxic environment is that two things. One is that absence of leadership. So there was no actual leader to change the environment. And the second thing, it was a boys' club. So there was only, I think, 2 female surgeons in Oman, and the rest were all men. So that had to change. And the way we changed it is that we found out that the graduates of medical school, the top graduates, are mainly female graduates. Top not just by academic degrees, but also attitude and dedication to work and so on and so forth. So by default, if you are going to attract the best and the brightest, then you have to be gender blind. It should not be. It should be an attracting environment, not a repelling environment. And when it's attractive environment, the way you attract people is that you have to show them respect, and you have to show them that the environment that they're going to come and join is a welcoming environment and respectful environment. And that's what had to change. So we made sure that in our interviews, there are no questions related to gender. So whatever you're going to ask, it has to be applicable to both boys and girls. This is the question. You cannot ask a boy or a girl as a question related to specifically to that gender. So that is what I really had to make sure. Second is that we had to change the mentality and the culture between the surgeons who are already in the working with us, to accept that females are as equal or even better sometimes than males in surgery. And that, you have to really work it diplomatically, at the same time firmly. So there was zero tolerance, literally zero tolerance to any behavior that is going to be degrading or downgrading the role of females in surgery. With that, we found that these bright students are applying to surgery. And whether they're men or women, they're applying to surgery. And for ladies, we also made sure, I specifically made sure, that they understand that if they want to get married, it's okay. If they want to get pregnant, it's okay. If they want to deliver, it's okay. It's not going to be something to be held against them. It's actually encouraged for them to have a family, for them to have kids. It should not be looked at as something that is negative. So they found that the most respect that they're getting as females is in surgery. So they're bright and they want somewhere where they are passionate about. So they loved the environment in surgery, so they became passionate about surgery. And then they convinced their families and their husbands and themselves that this environment is the best environment for me to be in, because it respects who we are. And that's how we attracted females to surgery. And of course, you have to maintain that, meaning you have to make sure that you are steady with whatever you have promised them that you're going to do. So we continue with that respect culture. We continue to counteract anything that is disrespectful to males or females equally. And that's how, I'm sure you came and saw how we have successful, very well respected female surgeons who are amazing, both clinically and academically as well.
Yes, and personally.
And personally, of course, yes. And I think for me, any environment that has the same gender, it becomes toxic.
Yeah.
Like even in gynecology, in Oman, we have mainly females. In surgery, we had mainly males, and that's, I think for me, it's always nice to have a mix of gender to make the environment healthier.
You said now about gynecology. I didn't plan to ask, but I remember that I think some of the students told me that in gynecology there are no men, like fewer men, because of religious or cultural, yes.
And not so much of religious, but cultural acceptance. Because in religion, there is no. It's not against religion for a male to be a gynecology doctor.
Mm-hmm.
But it's cultural, more of. So females would prefer to go to a gynecologist who's a female, and that's why. But for example, the same female, if she comes to surgery,
yes,
it's okay if it's a girl, if it's a man or a female. But it's a cultural thing, and we have to respect it.
Mm-hmm.
Yeah.
Do you think there are some barriers that the culture imposes without intention?
I think, everything in life has a positive and a negative side. Some have more positive than negative, and some have more negative than positive. I think that culture that we have gives more positives than negatives. The positives are, the sense of decency, sense of respect is always there. Freedom for women to express what they want and what they prefer, and they get respected for that. The negative part is that, for example, if you have a male medical student, they struggle when they go to rotate in gynae.
Really?
A bit, yeah. So they would examine females normally in surgery, but when they go to gynae, it's vaginal exam and it's more intimate part, more like private parts exposed. So they get difficulty in their rotations in gynae.
Mm-hmm.
So what we do is we have an elective period in medical school, and it's compulsory for everybody, every medical student, and it's done outside Oman, paid by the government.
Wow.
Yeah, so we send our students abroad for 6 to 8 weeks, the country of their choice.
Everyone goes.
Everyone goes. And then, so males, they mainly choose gynecology when they go abroad because they get more exposure when they go abroad. Yeah. So that's I would say the negative part of it, but more positives definitely than negatives for sure.
What do you think is the reasoning behind this going abroad program? I think it's really interesting, but in Romania we only have Erasmus in
Yes.
Europe,
Yes.
but that's during the summer, so outside the normal hours, or semester Erasmus,
Right.
or even the exchanges, like the international exchanges that you always have
Yeah.
there. But
I-
nothing given by the university directly or compulsory.
I think it's one of the best decisions that were made in our college to send students abroad, sponsor them
Mm-hmm.
to be sent abroad, and I'm actually in charge of that also. In addition to it, so I was in charge of the clinical electives. I'm still in charge of it. So what we have is we have collaboration with international universities everywhere in Europe, in the States, in Singapore, Malaysia, Australia, South Korea, Arab countries, um, Romania, um, where we send our students every year. So in their between this, like just before the final year, they go abroad and do a clinical rotation. I think this broadens the mind of the students, both scientifically and also culturally. So they need to see other system, how other people are learning, how other people are practicing, because every system claims that they are the best system, right? And you would not know until you actually go there and see it and practice it. So a lot of them, most of them actually come back with a little bit broader mind than when they leave. And we ask them also when they come back to give us feedback about their experience. And when we read their feedback, it's actually interesting because they see things and that we didn't even know that they need to see, but they tell us that I have benefited from this and this and this and that, and it's fascinating actually. And some of it also that some of them use that elective part to prepare for residency later
Mhm.
on, so they get recommendation letters from international professors. That helps their CV as well.
Wow, that's interesting.
Mm.
I think I read that you went to Egypt,
Mhm.
right? In your this elective.
Yeah. Oh, yeah. When I was yes, yes. How did you know that? Yeah.
It's a
Yeah. I
secret.
spent I spent it in Egypt. Yes. Yes.
Okay.
It was amazing. It was amazing. In Egypt, medicine is practiced differently. So I wanted to go there, and they teach. They have Egyptians are very well known with a very unique sense of teaching style, and it's amazing. They just make everything look easy when they teach. So I benefited so much from it. I was supposed to go to Australia and Egypt, half, 4 weeks, but I decided no, I'm just gonna continue in Egypt
I
through
love
the
Egypt
whole.
too much, so I'm
Yeah,
staying.
exactly. Yes, yes. That's what their teaching was just phenomenal. The way they teach you, and they have their own way of making the information very, very smooth. Yeah.
So as we started to touch the subject of teaching and students and so on, I would like to address a question that nowadays is more and more debated about how do you think the hobbies, so our hobbies, influence our academic performance? Because I know you did acting full time,
Yes.
like a lot, a big part of your life.
Yes.
And some people told you that it will put some breaks in the career.
Yes.
And I think it's also in medicine, a lot of medical students pause their hobbies or even
Yes.
renounce because of different reasons. So what do you think about this?
So I always tell the medical students um, that studying medicine is tough. So we're not debating this. There's no debate about that. We know that. I think time management is very important. Hobbies actually improve your performance as a medical student, not the opposite. Provided you don't spend so much time. For example, if you take swimming, like professional swimming, you have to practice every day. religiously every day. I know because my nephew, my brother's son, is a swimmer, and no matter he's sick, not sick, family they can't travel because of this of the swimming schedule. So that would not be a very good hobby. Professional swimming, you can go swimming, but not professional swimming as a medical student. But there are things like playing tennis or playing football or reading or playing the piano or playing a musical instrument. Um, uh, like these hobbies, you have to actually do more of them rather than less of them when you are, because they're very important in de-stressing, and like taking away the stress from you. You shift outside and then you come back with a fresh mind to study again. So again, we talk about priorities and making time for these priorities. So when you set time for your hobbies, that should be your priority then, and then you come back to your school, and then that becomes your priority, and you forget about the hobbies. Try not to mix, because sometimes people like really do it too much. Like for example, traveling. So they like to travel too much, and then when they travel, they don't study. They come back. So you see them are very well-rounded students in terms of they're very well connected and they're very popular and the stuff. And then when you see the other academic career, it's not that great. So that means they give too much to their hobbies over their academic performance. It doesn't mean that traveling or being, for example, an IFMSA officer is bad. No, because I've seen students who are very active in these activities. At the same time, they're doing very well in their medical school. So it's just when you try to find the right balance, I think it's the best, because it kind of it forms you. It forms your personality, your hobbies. It makes you. I always say this to every. If you're a doctor, if you're somebody before you become a doctor, if you are somebody before you become a doctor, you will never be an arrogant doctor. At least most times. But if you are nobody and you just all your life is just a doctor, I think that's a recipe for disaster, because you become the doctors who are arrogant and rude and godlike, complex. I think, in my opinion, is because they have nothing outside medicine, and that's all what they are. So when they put that white coat on, or when they go to the OR, they start, ruling. Yeah, the authority, complex comes into practice. But if you have other things outside of medicine, it makes your personality much, much better as a doctor.
Yes, but I think there's a big problem because medical students get overwhelmed by the amount of studying we have to do, and a lot of us fear to start or something else, or to have a hobby, for not to become less and less competent in university.
Sure. As I started saying, we all know that medicine is tough and there's a lot of, but other people did it. So I'm sure in medical school you have a lot of students who have their hobbies and they're doing well in medical school. I think as much as possible, try to practice your whatever hobby you like. In times where you have really hard time, like for example, you're preparing for your final exams. Okay, fine. So that's the time. So priority goes now to your final exam. You can put your hobbies aside, but never abandon your hobby because you're a medical student. It just adds to your stress because you have lost something that you really love. So it adds to the misery of you studying and a lot of exams and a lot of this and a lot of that. While if you are maintaining your hobby, you feel like, okay, yes, I am actually studying so much, but I also have a life, So that kind of gives you that feeling inside of satisfaction, and that you need to go on in life without breaking.
I also like to say that we are a human being before being a medical student.
100%, yes. You have to make sure that you nurture that part of your life in order to keep going. Otherwise, you're just gonna be easily broken.
In your attempt to make things different and create an inspirational environment for your students, I know that you're doing weekly cafe meetings for presentations.
Yes.
And I'm curious, what is your philosophy behind it? And if you can tell us more about it, because so that everyone knows. And what is your motivation to keep doing it?
Okay, for those who don't know what that means, we do every Monday and Wednesday. I ask my team to meet in a coffee shop at 7 o'clock in the morning where we have karak tea or coffee sometimes. They have, not me. And we do an educational activity. So we present a topic outside of the hospital. The coffee shop is outside the hospital. I actually started doing this when I was in Canada, when I was in Vancouver. I started introducing this idea of why don't we meet for a coffee or tea? There was no karak tea in Canada. But why don't we meet for a drink before work, where we can discuss a topic, so that learning becomes more fun. And actually, the residents started liking it, and the team, felt that we are doing something different. So they started investing more in making time to come to those activities. At the same time, in preparing the teaching activity as well. So they're learning. When I went back to Oman, I started thinking, how can I make things different a little bit, so that the residents and the students feel that there is something different to learning, instead of the classical, classroom teaching and come and present and then go home and read. And so I started introducing this concept when I met a friend of mine who has a coffee shop there, and in that coffee shop he has a walled off room, or it's a meeting room. So, and it's next to the university, so it doesn't take much time, and they make amazing karak. So they all came together, and the students and the residents, they love it now because they have 2 days a week. They meet up and we have scientific discussion, and we also have kind of a fun discussion outside work before we go to work. So they go to work, with a positive spirit.
And how do you think these meetings improved the life of the residents and students, and also like the whole team?
I think it improved these things, they go further than what you think. So it's not just that lecture that they're going to attend, or the coffee that they're going to drink, or it will change something in their mind, that they should always try to aim for something different. When they become doctors, full like qualified doctors or surgeons, they will always think, what was really positive during my residency training, and I'm sure that they will remember this, and then they will either do the same or they will become more creative and do something different. So that will change something in their mind for sure, and I'm sure it's going to impact them when they graduate from the residency program or from the medical school. To know that learning doesn't have to be always solid and dry. You can have fun, have meet outside, and we can learn as well.
I think those were the happiest days of my life, when I had to wake up at 6 or some very early hour to come there and.
Yeah, you experienced it yourself, and it was a happy kind of
Yes.
event.
Yeah. Completely.
Mm-hmm.
Yes, so I know that teaching is one of your passions, and I've experienced some of the positive influences myself. And as you educate students and residents on a daily basis, can you tell us some of the core values that you want to transmit through your mentoring strategy?
So core values, in my opinion, the first thing that discipline is very important in medicine. And I don't mean like harsh discipline, but coming on time or even before time, learning about your patients is very important. That is a non-negotiable. If we have a deal between me and my residents and my students, These are the non-negotiable parts of the deal. Is coming on time or before time, and knowing about your patient. Then comes how you deal with patients and how you respect patients. Um, and then your academic performance, meaning your reading and your studying and your knowledge base. That comes later. But the core values are discipline and respect for patients. I think that these are the core values of any doctor. That has to always be there, and it should get better with time, should not get worse with time. Especially when you become a full-fledged consultant or doctor, then you have more power over these patients. So you have to be more humble when you become more senior. You have to become more humble and more human when you deal with these patients. And that's why it's non-negotiable when you are a resident. Because if you don't do it well now, then when you become a full-fledged doctor, then it's just not going to get better. It's going to get worse. Yeah.
Yes, and I think also from what I observed, to treat the patient as its family, like you said earlier.
Yeah, leading by example is very important as well. So I cannot teach them something and then I do something else. So I make sure that they see that this is the way you deal with the patients. This is the way you talk to the patients. This is the way you respect the patient. Even if the patient is angry, there's a way of talking to the patient to make them, listen to you.
Yes. So you are a great supporter of a three-dimensional medical student profile. And as you also said about interviewing skills or even CV writing and communication, or even technology usage, you support these assets.
Yes.
So can you explain why these are so important?
Okay, I'm a bit biased towards medical students and people in the medical field in general, because I think that they're the best minds in any society, or the smartest minds in any societies. I mean, other specialties can also be very, very smart, but guaranteed that if you go into medicine, that you have a smart brain, at least I would say most of them. So for me, that brain needs to always be challenged, and also needs to be used in the utmost capacity. Underutilized brains are a problem, and talent. So one of the talents that the medical students should develop, more than reading and knowledge, is the other aspects of their life. So their hobbies, as we talked about, their family, and also their professional career. In the professional career, they need to know how to write a proper CV, how to have a proper CV, how to boost their CV, make it much better. What are the things that will add, like for example, you doing this podcast should go in your CV. That's a big deal when you apply for a residency program, and you as a medical student was actually running the podcast, or technical team here with you. They should put that in their career, in their CV. That's a big plus. You cannot imagine how big this is. The other thing is interview skills, because in medicine you will always be interviewed for positions. So it will be so sad that you are very smart, very knowledgeable, you have a good CV, but you just don't know how to do interviews. So that will take away a lot from your possible opportunities in the future. So medical students should know how to be good in their interview skills, because it defines your career. It will decide on certain aspects of your career tracks. And of course, technology. Maybe not in my generation, but this current generation, technology is, by the day, it's changing. I mean, in our days it was changing, but not so fast. Like now, like we're getting stuff that we didn't even imagine are happening. So medical students, because they're smart, they need to be flexible, and they need to know exactly what's happening around them. So they need to be well oriented towards the technological advancement. So because we're not talking about him being a doctor now, we're talking about him being a doctor after 7 years from now, for example. So the technology is changing by the day. So imagine years. So they need to know, they need to master their uh, knowledge of technology, because that is what's going to also define the doctor's career in the future. It's not going to be practiced like we're practicing it now, or when it was practiced when I was a resident or a medical student, for sure. So that's why I believe that students should be multifaceted in order to have the best use of their brain, basically, in the future.
Yes. And if you were to conclude, what would be top 3 advice or you would give to a student nowadays, to a medical student, despite the specialty he or she wants to follow?
Yes. So the best 3 advice, okay, one.
Magical number.
So one is that you need to understand how brilliant you are. Okay, so students, in order for you to have reached to that stage, just to enter medical school or be in a medical school, you've already achieved so much in your high school and in your life to be where you are now. So you have to understand the assets that you have, which are, you are brilliant. So that is one. To know who you are is very important, so that you know where you're going to be in the future. So you need to know who you are, okay? And you are brilliant. Okay, this is one. Second one is that studying medicine is tough. We know that. Everybody knows that. If you stop anybody in the street and ask him what is the most difficult studying in the world, he will tell you medicine. Okay? So enough complaining about it. Stop whining and complaining that it's tough and I have a lot to study and I had to lot. We know that. Everybody has done that. Every doctor in the world has gone through the same thing that you're going through. So instead of whining and complaining about it, formulate a strategy to deal with it rather than complaining about it, because everybody knows. If you sit in a coffee shop, if you stand up and say, medicine is difficult and I have a lot to study, everybody, yeah, and what's new? Okay, so that's the second part. So know who you are. Studying medicine is tough. Don't whine and complain about it, and just formulate a plan to deal with it rather than complain about it. The last piece of advice: the biggest enemy of you is you. You will be the biggest enemy if you start doubting yourself. So never doubt yourself. Okay, people can complain about, I have a bad teacher, or I have a bad system, or I have a bad whatever, or I'm not getting enough money, or there's so many, because doctors and students are very bright and high performance, so they expect everything to be the best, and they get disappointed. If you have high expectations, disappointments will be also worse or more if you don't get what you want. Then you start doubting yourself. So the worst thing you do is you doubting yourself. So never ever doubt yourself. Like, for example, saying, oh, I'm not going to do the USMLE because I'm not going to be able to do it, or I'm just going to do something, just bare minimum because I just want to pass, because I'm not good enough to be an A student, or to do more, or to innovate. So that's I think the worst enemy of any medical student or any doctor in general is self-doubt. So try to not doubt yourself, and push yourself as much as you can, and use your hobbies to help you out as well. These are the 3 points that I would advise the medical students. Know yourself, never doubt yourself, and don't complain about hard work. Just
do it.
develop a way to deal with it, because you already signed up for it when you joined medical school.
thank you. I think, yes, I think it's very valuable, and I really hope that people will listen this part because it's so true. And to finish in a more positive and unusual way, I want to ask you, what made you come back and in Romania so many times and like Romania so much? And maybe you can tell our audience how many times you came.
I lost count. I think I was asked by the passport control today, is this your first time in Romania? I said, no, no, no. This is probably my 10th or 11th time in Romania. Actually, the first time I came to Romania was I was invited by a medical student, Larissa. She came to Oman and as an exchange student, and she attended one of my teaching sessions. And then she sent me an email inviting me to Medicalis. That's the first time I come. So Medicalis was my first encounter with Romania. I didn't know what to expect actually, but I was pleasantly surprised when I came to Cluj the first time. I loved it. I loved the experience. I loved the energy. I love how the students here are hardworking and they're very, very organized and professional. It's amazing. I mean, we do one conference or one congress back in Oman, and it's everybody's drained out after that, and we don't want to organize anything for the next 5 years. But the students in Romania, not just in Cluj, they organize a very successful international congress every single year, and they do it perfect to the dot. It's amazing, the communication, the organization, the facility when you come here, everything to the dot. It's amazing. So congratulations to all of you, and I always take that to my students back in Oman, and I tell them about how brilliant the students here are. And then I got invited by students of Bucharest when I was in Cluj, and then by students of Craiova, and then by students of Iași. And this year I've been invited also to Timișoara for the first time. So
In Târgu Mureș.
and Târgu Mureș, of course, and Târgu Mureș, yes. So Târgu Mureș, I think I went 2 times or 3 times, 2 times, and Cluj maybe 5 times, 6 times. Bucharest about 2 to 3 times as well, and Iași once, and I'm going second time now in April, and Timișoara is the first time. So Craiova as well, I think 3 or 4 times. Yeah. I love being in Romania, and I love the connection with the medical students here, and I wish I can do more. And we also have Romanian medical students who come and visit Oman, and I'm sure they love it.
Yes.
You can testify for that. Yeah,
Also in medical exchanges or even for holiday.
that's right. Even for holidays, and they just love it because Oman is a very unique country, and I use that also to advertise for Oman and for our medical system for the students of Romania to come and experience the teaching and the environment there. It gives them also a different aspect of practicing medicine.
Yeah. And I think it's important to mention that everything is in English.
Yes.
So, for example, I didn't know before coming, like I didn't dig so deep into it.
Right.
And I was so impressed because I could understand everything and talk to the patients, talk to the doctors.
Yes.
Everyone was so welcoming.
And every teaching is in English. Yeah, and that's also something that our students face, for example, when they go for exchange in Germany, for example, or in Austria, or in Spain, or in Italy, that people talk in Italian or in their local language, and they don't understand anything. So, but in Oman, it's in English, so it's even more friendly to students learning. Yeah.
Yes. Oh, thank you for this talk. It was, I mean, I expected it to be inspiring because I knew you, but I'm sure that all the audience got inspired and motivated by your talk. And we really deeply thank you for accepting our invitation and being here today with us.
It's a pleasure.
And we are waiting back in Romania.
Yeah. Thank you so much. Congratulations for this amazing activity that you're doing, and for the team that is working with you. And I'm very glad to be with you here in Romania, and I'm even advertising for my residents and students to come and participate in the congresses.
We are waiting for all of you.
Thank you very much. I appreciate it.
Thank you, Dr. Hani. Until next time, I am your host, Andreea Mazga, and I encourage you to follow us on social media and send us your feedback. Lastly, I would like to thank the team behind the cameras and all the team of the Medvoice podcast behind the scenes. In addition, I would like to thank the Medicalist team and acknowledge them for making this podcast possible. See you next time.